Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, Medicare Open Enrollment, What You Need to Know, is presented by Kristi Caracappa. Kristi is the Health Insurance Information Services Coordinator at Washington Hospital. Without further ado, please welcome Kristi Caracappa.
Good evening. Thank you for joining us tonight for this presentation on Medicare. I'm Kristi Caracappa, Health Insurance Information Service Coordinator here at Washington Hospital. First of all, I'd like to talk to you a little bit about the Health Insurance Information Service. It's a service provided free here at Washington Hospital. It's an unbiased service, here to answer questions about health insurance and how to find a physician or medical center in your network. Health insurance information is available all year to answer any questions you have about Medicare, private insurance, or other government programs. You could also obtain advanced health directive forms and pulse forms in my office. So our objective today is to provide an understanding about Medicare open enrollment and also provide information to those who are new to Medicare or are going to be eligible in the next year or so. So, open enrollment. Open enrollment for Medicare Part D and Advantage plans is coming up October 15th through December 7th. So if you're currently enrolled in Medicare and have Part D or an Advantage plan such as Kaiser, United Healthcare, Canopy, those are times that you might want to take a look and see if there's any changes in your plan. Also with Part D to see what else is available for the year. Also, if you aren't on an Advantage plan or have a Part D plan, this would also be the time that you can enroll. Okay, so what should you be looking for during open enrollment? For your Part D prescription drug plan, you want to take note if you've had any changes in your medication. Does the plan you have now still cover the medications that you have for next year? And is there a new plan out there that could save you money on your premiums and copays? So if you have a Medicare Advantage plan or thinking of joining one, this would be the time to do it. What do you want to look for an Advantage plan is, does the plan cover all of your prescriptions that you're currently taking? Has the premium changed or will it change in the following year? Are there different copays or coinsurances associated with the services that you use? And are there any other changes to coverage within the plan, such as if they were covering durable medical equipment before and perhaps they're not covering it the same way the next year? Those kinds of things you would want to look for. If you have an employer retirement plan and also have Medicare, the open enrollment period may not affect you. Usually employer plans have their own enrollment plans every year. But you should still take a look because employer plans such as CalPERS, which is happening right now, has multiple plans and they do have changes. All right, so jumping into Medicare. When do you sign, if you don't have Medicare, when would you sign up for it? So when you're first eligible for Medicare is when you'd want to sign up. There's also a special enrollment period, or between January 1st and March 31st each year for the Part B, A and B coverage, but it won't start till July 1st. So we're going to go over each one of those. So when are you first eligible for Medicare? For most people, it's when you turn 65. If you've worked your 40 quarters under Social Security, you've earned your Medicare. You can sign up during a 7-month period during your birth month, either the 3 months before the month you turn 65, the actual month that you turn, and 3 months after. So if it's time for you to sign up, that's your enrollment period. There's also special enrollment periods. The initial enrollment period, you may have decided not to sign up for Medicare because you're still working or your spouse or dependent is working and you are covered under the group plan, the employer-sponsored plan. So you can go ahead and sign up for Part A, but Part B you might want to wait on. When you decide to leave the employer, or you retire, or the spouse retires, you would be eligible for the special enrollment period. So for example, if you decided you were 76, or I was going to say 67, if you're 67 and you decided you're going to leave your employment, then you're going to want to go ahead and start up for that Medicare A or B, you have 8 months after the last day, the last month of your employment. But you really don't want to wait that long. You should plan ahead and get your Medicare to start when you need it. I can also help you with the paperwork for that at my office. If you're leaving your employment and you have COBRA or RVA, that does not qualify you as still having a group health plan. Okay, so if you leave and your employer offers you COBRA for 10 months, at the 8th month you will need to sign up for Part B. So the last thing is general enrollment, the general enrollment period. So if you turn 65 and you you didn't want Medicare, you feel like you're healthy, you don't think you need it, and you decided not to sign up. Or you left your employer and you decided you just want to wait a year. Well, you missed those 2 enrollment periods. Now you are eligible to sign up between January 1st and March 31st. The only problem is that your Medicare won't start till July 1st, so you could potentially be uninsured for up to a year. So that's not the best time to be doing it. Okay, so with Medicare A and B, A is free, typically premium free if you worked your 40 quarters. Part B has premiums. The base premium is for 2021. I'm sorry, the 2022 premiums aren't available yet. So we're just going to talk about 21 right now, is $148, if I can find my cursor here, there it is, $148.50 per month. That's for somebody who is filing jointly and makes $176,000 or less. Their Medicare premium would be $148.50. If you're filing single, it would be $88,000 or less, you would pay $148. And as you see, it just goes up from here. So sometimes when you leave your employer, and by the way, they're looking at 2 years prior. So these numbers are based on your yearly income in 2019. This is what you'll pay in 21. So if you start out on Medicare, and let's say you're making up to $276,000 that year, you're going to pay $297 a month for your Medicare Part B. Now, if your income drops the next year and the next year, then this will go down after that. Your premium will go down. Oftentimes people start at this number right here, and as they have different life changes or they pull money out of different areas that are taxable income, selling of a house, that is a bulk of income, and so you could expect to see your premium go up that year. So that happens quite often. It's a little surprise, but then it goes back to what it was after that year. I know this is a lot to take in. Okay, so this is your Medicare card, if you don't already have one. There's your hospital Part A and your medical Part B. Shows the effective dates. And this is John Smith's card, who's allowed us to use that. I'm just kidding. That is just a fake card from Medicare's website. So the numbers do look like that. So this is your basics. This is where we start. If you're going on Medicare, you're going to get your Medicare A and your Medicare B. You need them both because A is for the hospital. That's just if you're admitted to the hospital. And B is for everything else. That's for your doctors, your imaging, some medications, not all medications, outpatient surgeries, emergency room, things of that nature fall under your B. Your A is only if you're admitted to the hospital. It covers the general hospital facility. All right? So we'll move on from here. We have the parts of Medicare. So we have Medicare A and B. That's your basic. That's the very minimum that you need to have. Then we have Medicare Part D, your prescription drug coverage. Those are things that you get outside the hospital or outside the doctor that you would go to your pharmacy. And then we have Medicare Part C, which are Medicare Advantage plans. So these are your Medicare options in a nutshell. So as you see, the original Medicare side, so you have your Part A and Part B under original Medicare. With this side, you have your Medicare card, you need to sign up for a Part D drug plan, and then you should pick up some supplemental insurance. What the supplemental insurance does is it pays the extra parts of Medicare. So Medicare Part A, when you're in the hospital, has a deductible. B has a small deductible right now, is about $203 for the year. But there's a 20% coinsurance. So that could get pretty pricey if you're hospitalized or you have imaging, labs. That 20%, can get you after a while. So you want to go ahead and get supplemental coverage. With this side, the original Medicare and these other parts, you could go anywhere in the United States that takes Medicare. They will take your supplemental coverage. All right? So this one, if you're not sure which direction to take, I always recommend starting here because you could always make changes later. On this side, Medicare Advantage, this is your other option. We talked about, let me go back here, Medicare Part C is a Medicare Advantage plan that we're going to talk about now. What that does is it combines, takes your A and B and a Part D drug plan, and it puts it into a C, which is Medicare Advantage. I like to talk about the plans that are available in this area. Kaiser, if you're from Fremont or the Tri-City area, is one of our biggest, I would say, Medicare Advantage plans. Others that I've seen are United Healthcare's Secure Horizons, Medicare Complete. There's Canopy plans, there's Aetna, there's a Blue Shield. Those are all, for the most part, there are a couple PPOs, but for the most part, they are HMO plans. So what happens when you join a Medicare Advantage? You still have your Medicare A and B, you're paying for that Part B. Most of the plans include the Part D in the plan. And then they cover other out-of-pocket costs. So if you were to sign up for an Advantage plan, you'd put your Medicare card away. You would use the medical card they give you, wherever you're purchasing it. If you purchase it from Kaiser, you're going to have a Kaiser card. And what happens is Kaiser notifies Medicare that you have signed up with them. They tell Medicare, hey, they've signed up with me. Medicare says, thank you very much. We're going to give you some money every month to take care of their medical needs. Now your provider is Kaiser. So you've lost the option to be able to go anywhere in the United States. You have to go to Kaiser facilities. But with that said, you can still travel. If you're traveling, if you're visiting in other places and something happens, something as small as a cold, something as big as, something really big, you will still get services. I don't want you to think that you can't. But if you have something coming up that you say, well, I'm here in Fremont, but I want to go to UCSF, or I want to go to a specialist in New York, with your original Medicare and a supplement, you could go wherever you want as long as the primary takes Medicare, okay? You don't need specialist referrals. You don't need referrals to specialists. You could go wherever you want. As long as it's covered, again, by Medicare, your supplement will pick it up. All right, that's a lot more information. Okay. So let's talk about those Medicare supplements that are known as Medigaps. As we move forward, I'm going to have a chart for you to look at, but just to go over it quickly, a Medigap is supplemental insurance that fills in the gaps in coverage to original Medicare, like that coinsurance and the deductibles I just talked about. Medigap plans are sold by private insurance companies and are lettered A through N, which you'll see in a moment. So no matter who you purchase your plan from, the coverage is the same. For example, if you purchase Plan N through Anthem Blue Cross or Blue Shield or AARP, it's the exact same coverage. It's mandated by Medicare. They just might have some added benefits, or their premium might be a different cost, all right? And there's not a traditional open enrollment period for Medigap plans. You could make changes during your birth month. So when you first enter Medicare or you become eligible for Medicare due to a disability, this is when you should think about getting your Medigap plan, because if you don't get it when you initially enroll in Medicare, it might be difficult for you to get it later. It's not a guaranteed issue at that time. So here we have the chart that I was just talking about that has all the different letters in it. So I have the arrows here. So Plan F So if you're already on Medicare, a lot of you are probably familiar with that. Plan F has 100% coverage all the way down here till foreign travel, which I'll just throw in there now. Foreign travel is not covered by Medicare. It is sometimes covered with limitations by the Medigap plans. Everything else is 100%. So what that means with 100% is your Part A deductible and coinsurance are covered 100% under these plans F, G, and N. Plan B coinsurance also covered 100%. That's that 20%. That's what we're mostly trying to cover, because if you're hospitalized, you're going to have typically a pretty large bill, and Medicare will pay 80% and you will pay 20%. So this picks that up. So virtually, if you have Plan F and it's a Medicare covered service, you will not have a bill. Sometimes you might get a bill, but the bill's usually because maybe you didn't provide that secondary insurance, or something crossed incorrectly, but you could get it fixed. So that I like to call it the gold standard. Unfortunately, if you would have to have turned 65 by 2020 to get Plan F, so it's no longer available. Plan G is just like F, with the exception right here of the Part B deductible, which is $203. So for this year, I'm sorry, it could change next year, but it's $203 now. So basically, it's just like F, but you have to meet that $203 deductible, and then everything's covered. All right. Then we have Plan N. Plan N is probably the lowest I'd recommend. Typically, what I see is people with F and G, they keep that till they're in their mid to late 70s, and then the premiums do go up every year. So if it starts to feel uncomfortable, people will come in and say, "What should I do?" I refer you to a broker, an insurance agent that sells insurance, for you to look into other options or other plans, either other companies or other plans. But these are the three basic ones that we see on a regular basis. Okay, moving on. We're going to talk about Medicare Part D prescription drug coverage. Excuse me. Excuse me, I'm sorry. Medicare Part D drug coverage. So if you have A and B with a Medigap, you'll want to add Part D. There are several plans offered by private insurance companies that are approved by Medicare. Those can be found on the Medicare website or with an insurance broker. There's about 24 of them. So depending on your coverage, you'll pay a monthly premium and sometimes a copayment, depending on the plan. You'll pay that at the pharmacy. If you don't take Part D coverage when you're first eligible to do so, you may have to pay a penalty if you decide to get it down the road. Actually didn't talk about that, but Part B is also, if you don't get Part B when you're eligible for it and you don't meet the other criteria, if you decide to sign up for it later during the other enrollment period, then you will have a penalty for your Part B for life. All right, so let's look at the Medicare.gov website. What we're doing here is I want to show you the Medicare drug plans, because if you already have Medicare, which is a lot of the reason why people are watching today, you will, excuse me while I get on here, this is what I do during open enrollment. You can go to the website. I'm sorry, I'm having a little problem scrolling it. There it goes. That's Medicare.gov. Go to Find Plans. And you want to find a Medicare plan. Right here is where we can either look at a Medicare Advantage Plan or Medicare Part D. We're not going to look at Advantage plans because there's just so much in-depth things that you could look at. If you want to make an appointment, I could come in and show you how to do that. But for now, the Part D is basic for everybody. So we're going to continue without logging in. I recommend that you do set up an account with the Medicare.gov site. But we're just going to go in as a layperson here, and we're going to search. So we're going to look for Part D drug plans. We're going to enter the zip code where we're at here. Okay. I'm just going to say that I don't get help from any of these programs. So if you have, it has Medicaid, but that would be Medi-Cal. Sometimes there's other savings programs, but just for the sake of time, we're not going to go over those right now. Okay, so we'll move on here. So do we want to see the cost to compare plans? Well, absolutely, that's why we're here. So we're going to put in some medications so I could show you the different plans and prices. So I put in, that's atorvastatin. It's one a lot of people take, so I always like to put that one in. So this would be a person who has high cholesterol and diabetes. Unfortunately, let's see. Let's go Humalog. I think that'll show us in a pen. Okay, so that's for one box of insulin pens. And we'll do another popular medication that's very pricey, which is Eliquis. I see that quite often. Not a medical professional, just so you know. I'm just picking out things that I've seen in the past. Okay. So I've entered, these are medications that perhaps somebody's taking monthly, these three. I picked them because insulin used to be a lot more expensive through Medicare Part D, and it's actually become much, much more affordable. Eliquis is a brand name drug that has come out in the last few years, and let's see here. It has come out in the last few years, and it's sometimes difficult to pay for. So I wanted to show you how we can compare with those brand name drugs. So right now, so it wants to know about your pharmacies, which is important. That's how you're going to get your pricing. And we're going to say mail order, because mail order is also always a good way to save money, and it's obviously very convenient. Walgreens in the area, we have a lot of Walgreens, and we have a lot of Walmarts. So I'm just going to choose those. There are, in that list, you could have picked out small mom and pop pharmacies that would also be in here and can be covered, but just for the sake of time and understanding, I'm just picking out the larger retails. You don't have a choice with each plan on your mail order. You go with the mail order that the plan has. Okay, so what we did is we entered 3 medications. One was super generic. The other was an insulin that is being paid for better now than it has before. And the other one is the brand name drug. So this will give us a nice look at things. During that, you could enter up to, you could 20, 30 drugs you could enter and come up with the same type of result. So here, how this comes up, there's, I think I said 24 different plans. Just for discussion's sake, what we're looking at right now is 2021, okay? So the prices that are coming up for me are only going to be for October through December, okay? These are for the rest of the year. So during open enrollment, it will show me the cost of your meds, premiums, and copays from January through December. So this tool will help you budget your money every month for your medication, okay? And also people ask me, well, what if I end up taking something else in the middle of the year? There are adjustments that can be made. You can't change plans, but oftentimes the plan, if your medication is not on their formulary, they'll make adjustments for you if your doctor fills out the proper paperwork. So let's go here. I entered those medications. It shows me what I'm looking for is what is my lowest cost for the year. So the first one that came up was Anthem Blue Cross. The premium is $79.90, which is actually one of the higher premiums of all the plans. It does not have a deductible. It's also one of the few plans that don't have a deductible. But it shows here that at a retail pharmacy for the rest of the year, that's total drug and premium costs would be $333 for the rest of the year. If I did mail order, it's a little more expensive. That does happen. Okay, so I'm going to scroll down, but I'll go back up to that. Actually, I'll probably pick this one. This one is pretty pricey too. AARP Medicare Preferred. That one is $99. So as you see, it has a higher premium than the other one. I'm sorry, I don't know why this thing is there. There we go. That one has a higher premium, but not a big difference in the rest of the year. And it also has zero deductible. This one is AAR, so they're not alphabetical. They're all by price. I just want to show you one that has a deductible. There it is, because most of them do. There we go. Sorry. I think I need a mouse next time. Please stay with me. Okay. This is what I want to look at. Okay, I'm going to look at the plan details. Even though this one was more expensive, normally what I would have done is looked at the first one or compared three. But this one I want to be able to show you the different areas. So this comes up, it shows it's $29.20 a month, so it's a lot less expensive in the premium, but the drugs are more expensive. So, and you also, I think why this is happening is because of the deductible. But let's take a look. Okay. Shows your drug deductible. I'm sorry, I just don't want this to go too fast. The drug coverage. So as we scroll down, it shows us our pharmacies we picked out. It shows preferred in-network. These are preferred. So a lot of times it'll say in-network but not preferred. So the good news is if these were your go-to pharmacies, you can go wherever you want. You're going to be covered at the best possible rate. Then it shows us here the yearly cost of the drug. So from October to December, the most you're going to pay is $323 for the generic atorvastatin. Your Eliquis, you're going to pay, because of the deductible, $210 for the rest of the year. And the insulin is $307. That's just for 3 months. Again, that's because of the deductible. If I'd looked at the Anthem, it would probably be less. Let's see what we have. Total yearly drug, and also they changed the website this year, so if you've gone on it before, there's a whole lot of places you could click, look at, analyze, but we're going to just do the basics. So it shows us here the total cost for the year, depending on the pharmacy. It shows us in November we're going to pay $470 with our premium and picking up our medications, and in December we pay $51. So that means we met our deductible in November. Okay. And then if I could open these and it'll show us that Walgreens, how much it is. So the first column is showing us the retail cost of the drug. The next one is showing us the deductible. In here, this would be your, once you've reached your deductible. And then this is the donut hole, if any of you remember that, or coverage gap. The nice thing about this, when you're in here, there's a place you could click and it will explain the coverage gap. And this is a lot of information, and again, I can go over this with you one-on-one if you want more information. It will also tell you if your drugs, this is an important thing to look at, if your drug is, what tier it is, or if it's not covered at all. Sometimes you'll see, wow, that's a lot of money. Well, if you look down here, it might say not on formulary. But these are all tier 1, tier 3, tier 3. Okay? And it shows you what we entered. So it has a lot of information in here, what you're going to pay. And the big thing is this will help you decide what plan you want for the next year for total out-of-pocket costs. And it will also help you budget. It will tell you if you're going from January to December, well, I need to have this much money in January. This is how much it'll be. You will get a break at some point with some of the payments. And then if you go catastrophic, you pay very little at the end of the year. So let's see if I'm going to go out of that. So that's the Medicare.gov website. So through that, you can also look at the Medicare Advantage plans. If you set up an account, you can also see, you could print a Medicare card if you lose your Medicare card, and you can also look at the plans that you currently have and what are coming up. All right, moving forward. Part C Medicare Advantage plans. Again, I already explained on the Medicare website, you'll find plans that are available in your zip code. That's how the Part D and Part C plans are sold. They're sold by area. So if you choose an Advantage plan, it'll tell you what's being sold in your zip code. That's because you're going to more than likely be in an HMO. You're going to have to pick a medical group, and then you stay within that zip code. Okay? So Medicare Advantage plans, they're offered by private insurance companies, like I've mentioned before. You don't use your Medicare card. You receive a card from the Advantage plan. You do want to keep that Medicare card. Your premiums will still need to be paid, or they'll be coming out of your Social Security. And they must cover all services that original Medicare covers, except hospice. So what that means is they will cover everything Medicare covers, and then sometimes they'll cover, instead of covering the whole 20%, they might do a copay. On some cases, they might cover it 100%. At the most that you should have to pay is 20% of the fee. Medicare Advantage plans may offer extra coverage, such as vision and dental, gym memberships, things of that nature. Each one is different. And each Medicare plan can charge different out-of-pocket costs and have different rules on how you get services. Those rules on how you get services are usually getting referrals to specialists, or sticking within a group, a medical group like Hill Physicians, Palo Alto Medical Foundation, and others. And these rules can change each year, which is why we're here today, because we want you to look at your Advantage plans, make sure that they're still covering you the same. Because once open enrollment is over, then you're not going to be able to make the change, okay? So let's say you're considering an Advantage plan. What questions should you ask? So you want to know what medical groups are included in the plan. You want to ask your doctor if they are in the plan. What hospitals can you go to? Does it cover your prescription medications? What are the co-pays and co-insurance? And what are the out-of-pocket maximums? So even if they have things that you have to pay 20% on here and there, or they have some high co-pays, there's always an out-of-pocket maximum on the Advantage plan. So it caps you, and then you're covered 100% for the rest of the year. So that is something to look at too. Actually, I think they are regulated now that they're around $6,000 a year is the max they could charge you. That doesn't include the premium before things are covered 100%. Okay. So if you want to make changes to your Advantage plan, if you're in one, you choose a new one. And after December 31st, you decide, you get the plan, you get the card, you start finding doctors, and it wasn't what you thought it was. You have from January 1st to March 31st of 2022 to switch back to your original Medicare and get on a Medicare drug plan. Now, if you were already on the Medicare Advantage plan and you just did nothing, that doesn't apply to you. It only applies to you if you made changes and then it wasn't what you thought. So it's kind of a nice safety net for you. So some medications are covered under Part B. So those medications are usually medications that are administered in a physician's office or in the hospital, such as drugs that are used with durable medical equipment. So if you have insulin with a pump, your insulin is now covered under Part B. And that's really important to know, because you will buy the same insulin for your pump as somebody who might buy that they're injecting themselves. So the person injecting themselves, their insulin is under Part D. It might cost more money. If you have original Medicare and a Medigap, and you're picking up that insulin, it's covered 100%. So that's another reason you might want to consider, between the Advantage plan and the supplement. So those are questions to ask. Also, breathing medications, such as a nebulizer, the albuterol or whatever they're putting in the nebulizer is covered under Part B. Injectable osteoporosis drugs, some of them injectable and infused drugs such as chemotherapy. You'll see on the Medicare website when you're looking at the drug plan, you don't want this to scare you. It says chemotherapy not included. The reason is it's an infused drug that is covered under Part B where it is being administered. Oral end-stage renal disease drugs and enteral nutrition, such as feeding tube nutrition, that is covered under Part B. So extra help. If you meet certain income and resource limits, you may qualify for extra help from Medicare to pay for the cost of Medicare prescription drug coverage. So with extra help, if it's under Medi-Cal, Medi-Cal would pay for your Part B premium. You can sign up for any plan that has they would have a zero premium, and you would never pay more than, I don't have the exact number, I want to say around $4 per month for any medication. Okay. Also, if you're on Medi-Cal and you have extra help, you could also change those drug plans any time of the year. The open enrollment doesn't apply to you. You can do it in January. You don't have to come when everybody's busy. You could do it at any time. So I want to talk about scams. So health insurance companies, they must be licensed within the state of California. So if somebody's calling you from Georgia trying to sell you something, they might transfer you to a California agent. And the plans might be different because you have to, in the state of California, if you're living here, you have to buy your insurance through a licensed agent in the state of California. So that's just something to be aware of. And before you purchase a plan, ask to have information sent to you on the plan details. If they refuse to do that, then that's not a good thing. It's probably a scam. Don't give out your Medicare number or Social Security number to anybody who calls you. Social Security will not call you. They will send you a letter. They will give you a number, an access number for you to refer to when you call them. And Medicare will also not call you. You can call them. Okay, so, and that number, to be safe, is on the back of your card. Or if you, if you have a Medicare manual, it'll be on that. But those are the safest places. Don't Google the Medicare number because there's a lot of numbers out there. You want their numbers. So be aware of phone calls and mailings that you did not initiate. I also want to talk about, because I get a lot of calls about this, we get there's a lot of advertising coming out now, and it was last year as well, about telling you that you may qualify to have your Part B premium paid for, or have your Medicare free, and that there's a lot of extra services that you could get. Those are Advantage plans, and they're fine, but the advertising is very aggressive. So if you were to call one of those numbers, it might be from another state. They're going to send you back to California, and what they want to know is they want to know what your income is so they could see if you qualify for Medi-Cal, which would be great. It would help pay for things, but they're trying to get you to sign up for their Advantage plan, and their Advantage plan might not be as good for you as something else that you could get. So always, seek out the advice of a professional, such as a licensed broker. We have a lot of good licensed brokers in the area. If you need help assessing something, you could call me. I'd be happy to look at it for you. I work with a lot of licensed professionals in the area that I can direct you to. Okay. So with that, here's my name, my phone number, my email address. Please feel free to give me a call. I'm taking appointments now for Medicare Open Enrollment. And for the whole year, if you're new to Medicare, maybe not till next year, and you want to make an appointment to just go over some of these many, many details I just gave you, I'm happy to do so. And if you just have questions about private insurance, if you have perhaps kids that are coming off your insurance and you want to know what the insurance options are for them, I can help them with that as well. So any insurance questions, or we are unbiased. We help people from all different institutions in our Tri-City area. So thank you for joining us tonight. I'm ready to take questions if we have any.
Thank you. Our first question. Each year, I help my mom with her open enrollment, but I moved out of state before the pandemic. Are you offering virtual appointments or phone appointments? And if so, can I join?
So yes, I'm offering phone appointments. I'm not doing, I don't have Zoom capability in my office to do that, but I am offering phone appointments.
You have been very helpful every year helping me with my parents with open enrollment. Are you allowing others to join the client's appointments?
Yes, there is. I am allowing at least 3 people in my office at one time due to space. We're keeping it social distance.
That leads to my next question. How safe is it to visit you in your office for an appointment?
It's very safe. We have protocols set up here at Washington Hospital that have very strict CDC guidelines. When you come in to the building, you need to hand sanitize. You get a brand new mask. And in my office has been set up with social distancing measures in place and air filters and open doors. So it's safe.
And our last question for the evening. I'm new to learning about telehealth and telemedicine. When choosing an Advantage plan, should I ask if this is included?
Yes, you should ask if it's included. Telehealth is just gotten so very popular. You should check. What I'm finding is during the pandemic, things, different. There's been different coverages for different things. Most of the time, the telehealth is billed just as it would if you were to see a doctor in person. But it is always a good idea to ask, because this is a fluid process that changes constantly. So I would definitely check with the provider as well as your insurance company. It's a good idea.
This concludes our program. Thank you, Kristi, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of this evening's event will be available on Facebook and YouTube.